U.S. Surgeon General calling loneliness a public health crisis. The doctors released an advisory calling attention to isolation and the lack of connection that he's seen in America. He says that even before the pandemic, about half of all adults said they were experiencing loneliness every day. And he says loneliness can raise the risk of premature death by 26% and social isolation by 29%. Those conditions have also been linked to increased risk of stroke, heart disease, dementia, anxiety, depression, and self-harm. Dr. Fahmi Farah is a medical expert and a board-certified invasive cardiologist based in Texas and joins us now. Hello, Dr. Farah.
Hi.
Glad to have you along here today because this is amazing that actually, calling this a public health crisis, calling loneliness a public health crisis, and yet it does seem attached to some very serious medical conditions, right?
It does, yes.
Tell me exactly how they're connected.
Yeah, typically speaking, when we're isolated, we tend to get lonely, and loneliness, if prolonged for some time, it can lead to mental health issues like depression and anxiety disorders, and those things are associated with higher risk factors for cardiovascular diseases, and as you mentioned, increased risk of heart attack and stroke. And part of the reason is, of course, depression itself is a risk factor just because there are some certain hormones, like really stressful hormones that your body releases and that are detrimental for those things like stroke and heart attack. But additionally, when somebody's lonely and depressed, they're less likely to have a healthy lifestyle. They're less likely to eat healthy. They're less likely to go and exercise. They have sleep disturbance. They usually have a hard time sleeping. And those are all huge risk factors for cardiovascular diseases like heart attack and stroke. So those would be some of the things that are involved.
Wow, it's kind of scary, just before I saw this, I'm thinking, loneliness is certainly something to worry about more just with mental health and not necessarily the rest of our body, but this is telling me different.
Absolutely, yes. No, it's a whole connection. Your mind, body, they are connected, and one impacts the other. Your mental health is a huge, it plays a huge role on your overall health, especially something so important like your heart.
And so, aside from, the risks to our own personal health, I mean, this is a huge, huge ding for the economy because of what it's costing the health industry.
Oh, absolutely. When you're not feeling well, as I mentioned, everything goes up. Your people who have high blood pressure, their blood pressure is going to be higher. People who are diabetic, their diabetes is going to be out of control just because they're just not able to take care of themselves. So those hospitalizations the rate of hospitalization goes up for a multitude of reasons. Uncontrolled high blood pressure, uncontrolled diabetes, of course, the rate of heart attack and stroke. And then just the mental health aspect alone, that burden is huge on the society.
I don't know if it's just, what's the easy answer to this? Because it seems like there's so many. I mean, the doctor is saying about half of U.S. adults say they've experienced loneliness, and that's a huge amount of people to worry about.
It is. Unfortunately, there's not an easy fix. It is something that's going to take a long time to fix, and it's not something that anyone can fix on their own. It's going to take the whole community to come together as a whole, from an individual level to families, to friends, to even work sectors like, take healthcare industry, for instance, work hours. All of those matter. Your work colleagues, how willing are they to be supportive? And then government level, implementing different programs, support groups. I think it's going to take the whole society as a whole to fix this, and it's going to take time.
Yeah, and I would say, I think there's a lot more single people out there than there has been, in decades past, but that doesn't necessarily mean those people are lonely, but probably those who are probably less engaged with their family members, their community, those are the ones who are probably feeling more the acute feeling of loneliness.
I agree. Our dynamics have really changed. People's relationships have changed. The way about has changed. So with the advent of technology and social media, there are a lot of pros, but there are some really big cons as well. And one of the cons we're seeing is the change in social dynamic and people just being more single. And, we've had studies done on this before too, like people who are in a happy relationship and happy marriage, they live longer. And for all of these reasons, it's because they're happier, and so they're not suffering from mental health issues like depression and anxiety. And as a result, they're able to take better care for themselves. They have that inherent support system at all times at home. Whereas now a large number of, U.S. population is suffering from loneliness because they don't have that partner. It's so much harder to find a partner nowadays because, that social scene just doesn't exist anymore as it did before. Like people used to be able to just go out and just meet people. And not many people are doing that anymore. It's all on dating services. So it's just like very, very complex complex changes that have happened in the recent past in our society. And a lot of people just don't know how to cope with that.
Yeah, scary stuff. And of course, the pandemic. I mean, we can talk about that for days on end, but that's certainly, of all the things that I think it changed, was that interaction between people. And if people were already feeling a little bit lonely and out of sorts and not being connected to people, I mean, certainly the pandemic just amplified that to the nth degree.
Oh, absolutely. I believe the pandemic was a catalyst to an already existing problem. So you're absolutely right. It certainly amplified it. In the last 3.5 years, people have become a lot more isolated. And when something like this prolongs for so long, when it takes years, now we're seeing the aftermath effects. As you know, as a result of the pandemic, the rate of heart attack has gone up, the rate of stroke has gone up, the rate of hospitalization has gone up. So it has had a detrimental impact across the board. Certainly in family situations, like the social scene has truly changed, and it's in a very negative way.
So, certainly there's no quick fix to any of this, but for anyone listening, the thought is, I would say, is if you're feeling a little bit isolated, maybe you lately haven't been, and maybe even before the pandemic, really not connecting with a lot of people. I mean, you got to think about what this is doing to your body, not just that sometimes you may feel a little down, but you do have to watch the links that it's causing, the increased risk to physical harm.
Totally agree. Yes, people have to be mindful of their feelings, and if they're feeling lonely, that networking is very important to keep up with your family members, friends. Make sure to talk to them and keep in touch, and responsibility both ways. Friends who know that they have, someone is feeling lonely, like just reach out. Reach out to your neighbor. So being that good neighbor, I think it's time for us to all be that good neighbor to our friends and families.
Wow, very good advice. Thank you, Dr. Farah. Appreciate it.
Thank you for having me.